Have you at any point had significant medical procedure? If you have, you will realize that once the sedation has worn off, the principal thing the specialists and attendants expect of you is to get up and move. This is because the medical establishments recognize that movement is important. It impacts the cardiorespiratory framework. Heart and lungs are significant muscles, and the musculoskeletal framework, for example. Bones. Did you realize that for at regular intervals of bed rest, the pulse expands 1 beat? Did you realize that inside 8 hours of immobilization of a muscle in the abbreviated position, muscle strands start to abbreviate, restricting full scope of movement? At any point struggle getting those legs to move once more, in the wake of sitting in a cinema for only 2 hours? So what does this have to do with sarcopenia, and what is sarcopenia? Sarcopenia is a process where the body loses muscle mass. Sarcopenia has many causes. 1. Danger of falls and diseases. This is the primary cause of sarcopenia. Muscles need improvements. Sarcopenia, when muscles get old. The interpretation of the term sarcopenia sounds bizarre on occasion. In any case, it alludes to the diminishing in bulk with age. The results are complex and cut off the personal satisfaction of those affected. Sarcopenia is gotten from the Greek sarx equals meat and penia equals lack and depicts the age-related decline in muscle mass. Sarcopenia is a reformist loss of bulk and muscle strength. The infection can happen at whatever stage in life. Nonetheless, the more seasoned you are, the more probable it is that sarcopenia happens in light of the fact that the provocative cycles are more grounded. Irritation-related proteins, alleged cytokines, which advance the breakdown of muscle mass. The figures outline the cycle. From the age of 40, individuals lose 1 to 2% of bulk each year. This continues into the 80s. The outcome is more vulnerable muscles that tire all the more rapidly. At the point when precisely one discusses sarcopenia isn't clear. With sarcopenia, then again, there is a decrease in bulk just as muscle strength. With getting old, there is an expanded breakdown of protein in the muscle. A decline in chemicals, for example, testosterone or estrogen, additionally advance sarcopenia. Hereditary inclination additionally seems to assume a part. Furthermore, to wrap things up, the illness ought to likewise be identified with a low nutrient D level. The sun chemical is to a great extent framed in the body through UV radiation on the skin. An adequate stockpile balances muscle breakdown. Likewise, diminished actual work and a low admission of proteins through eating routine can expand the seriousness of the infection. Dangers of falls. Most people 65 years and older enter hospitals because of falls, primarily due to imbalances in their bodies. For instance, they cannot stand straight and as a result, fall. Bone and muscle well-being are firmly related. Every time the muscles move, the development of the bones is invigorated. In the event that the bulk diminishes, the bone substance suffers. Sarcopenia, articulated sarcopenia, is the age-related loss of muscle. The word comes from the Greek for substance decrease. It can have similar genuine musculoskeletal outcomes caused from bed rest. Actually, like osteoporosis and joint pain, sarcopenia is a genuine degenerative condition that builds one's hazards for falls and makes one more defenseless against injury. More subtle outcomes are metabolic impacts. That outcome when muscle, the body's most metabolically dynamic tissue, decreases. Digestion is adjusted when there is less muscle, and numerous different outcomes result, like heftiness, impeded glucose resilience, and changes in the capacity to manage internal heat level. Likewise, mobility help keep bones solid. Muscle misfortune can likewise debilitate bones. Sarcopenia by and large begins to set in around age 45, when bulk starts to decrease at a pace of around 1% each year. As bulk decreases, so muscle strength. Studies have uncovered that muscle strength decays by roughly 15% each decade in the 60s and 70s and around 30% from there on. As strength goes, so does actual working, the capacity to tackle errands, go for strolls, climb steps, or the achievement of different exercises. This is the reason why the older ones gets, movements becomes slow and impossible. Indeed, even some action, regardless of how restricted, can help keep up bulk. Sarcopenia happens in individuals of all wellness levels, anyway genuinely latent grown-ups will see a quicker and more prominent loss of bulk than truly dynamic grown-ups. Ladies, be that as it may, face a more serious danger than men, since ladies have less muscle than men, and the individuals who have less muscle regardless, by and large have a more prominent misfortune. Nourishment can likewise be a factor in the advancement of sarcopenia in the event that one isn't burning through satisfactory energy admission. Many people may not be eating enough calories as well as protein, subsequently not getting enough protein to support energy necessity. Can sarcopenia be treated and additionally prevented? One way to help beat sarcopenia is by doing resistant training. Weight lifting or strength preparing. One needs to construct muscle by constraining the body to recuperate the harm to muscle cells that happen with use. Despite the fact that it has been known for quite a long time that obstruction preparing builds bulk and strength in youthful grown-ups, many felt that muscle misfortune in more older folks individuals was unavoidable. Can activities such as walking and swimming prevent sarcopenia? The first thing is to check with your physician and ask him or her if exercise, especially strenuous exercise, is alright for you. The second thing to do is to know your limits. Start slowly and with lighter loads. Then, increase the heaviness and frequency. Set aside a time in the morning or evening or whatever suits you and your personality. Are there different advantages of resistance training? Yes, as muscles become stronger, there is more movement and less pain. That in itself should be an encouragement to see the importance of exercise. It also needs to be noted that one must continuously do that so that physical activity becomes a habit and part of you. The rewards thus will be many.